Basically, everything that's necessary to ready the patient for transplant, from the point of the patient being referred to our program to the point where the patient is either placed on the transplant list or in the operating room getting a living donor transplant. And if they're placed on the waiting list, then I'm responsible also for keeping them updated until they're in the operating room. So one way or the other, the patient is my responsibility from the point of referral to the point of surgery.
One patient told me that I am everything to everybody. One patient referred to me as the quarterback because he said that I try to tell everybody what to do. I try to direct the patient to where they're supposed to go. At the same token, I'm also a patient advocate. I can be their sister, I can be their primary care doctor sometimes, even though I'm not a doctor. But I don't give advice, I don't give medical advice. What we do is we get all the records, we get input from their endocrinologist if they're diabetic, we get input from their GYN, from their primary care, from the nephrologist most especially, and from their family. So we try to put them all together. So trying to put everything, all the pieces together, and then make into one big patient or one person, so that the whole team, especially the surgeon, can see them and examine them and then make the best possible recommendation as far as kidney transplant is concerned.
We have such a diverse population that we have to really assess where the patient is. We're talking about putting a human organ in their body. We're talking about something that's life-changing, forever life-changing. But you have to assess where that patient is. We have some patients that we have to teach from the very beginning. We have some patients that can grasp some of the information a little more readily, but we have to go to where the patient is, because the bottom line is we have to make sure they all get to the same point. They have to be able to successfully manage transplant. And in doing that, what I find very important and what I like the most is that I go back to the patient to find out a little bit of their perception of their history of disease. How did they get in this position? What did they do? What did they not do? When did they first hear this? If you have someone that tells you, someone told me 10 years ago something was wrong with my kidneys, but then all of a sudden I have to go on dialysis, there's a void there. You have to start retraining the patient. You have to train them what to look for. You have to train the patients that they have a big responsibility here, because we're doing some things that are going to change their life forever.
There's a lot of work that is entailed, making sure that they are healthy enough to go through the process of transplant, but at the same token, do they have enough support? And altogether, at the end of the day, what you want to see is they're able to go back to a better quality of life. And what that gives us at the end of the day too is being able to say that we are a part of making that difference in their life. It really does. It does make me feel good. I've seen a lot of patients that, would, after the transplant, they'll give you a hug and they'll tell you, you made a difference. And I also know that because of the job that we do and the work that we do, these people are able to look forward for another 10, 15, 20 years ahead, feeling good and being healthy the rest of their lives.
We also are responsible for everything to do with a living donor. If they have living donors, we evaluate them, see who's compatible, see who's medically and psychologically a good candidate to donate, and try to promote living donation whenever it's possible. So it's a lot of details, it's a lot of information, it's a lot to juggle at one time, but it all comes out at the end as a successful transplant, and it's very gratifying. It's difficult, but it's very gratifying. And when you can help a person have a second chance at life and a longer life and a better quality of life by your efforts, it makes your efforts worthwhile. We also are on call, which means that 24 hours a day, 7 days a week, one of the 4 transplant coordinators is on call. Today it's me. And if there's any potential deceased donors that come up for our patients, we are called about that. And that can happen at 1 in the afternoon, 2 in the morning, 4 in the morning. Usually happens at 4 in the morning. And that's sort of like a separate job, part of our job. And that has no boundaries to the hours. Now, I feel lucky to have a job like that. I don't always feel lucky at 4 in the morning when the pager goes off, but when I see the fruits of the labor, then I feel lucky.
Family, because we have a saying that if we transplant a patient, we transplant the whole family. And we try to treat our patients like a member of our family, because